When you look at the results of kidney transplants and dialysis treatments from 1996 to 2013, you see a 28% reduction in deaths for patients undergoing dialysis, and a 40% reduction in deaths for transplant patients. What does this tell us? That the chances of survival are significantly better for patients who undergo kidney transplants than for those who remain on dialysis. Perhaps even more importantly, the quality of life and sense of well-being that patients experience after transplants are also better due to both a more effective correction of renal failure, and the fact that most of the transplant patients with a successfully functioning kidney can forego dialysis 90+% at 1 year. After successful transplants, patients can often return to work and resume most activities they were able to do prior to their kidney failure. Family time, sexual functioning, general well-being, and physical endurance for day-to-day activities is also much better. Women of childbearing age can often even consider having children. This is also true of other solid organ, liver, heart transplants as well. We see uplifting stories of transplant patients in the news doing extraordinary things like winning Olympic medals. How do we know this much about transplant and dialysis patients? The United States Renal Data System (USRDS) is a true miracle of transparency in medicine. The USRDS tracks the results of dialysis and kidney transplants across the country. By law, all kidney centers must report each kidney transplant to this registry, and must follow up on all patients for the rest of their lives. The treatment results are available for everyone on the internet to see. Each center is named, and the patient outcomes for each one are part of the public record. A new kidney means a new life for the patient. In fact, the quality of life is so much improved for transplant patients that some have told me, "My kidney is more important than life itself." Although this might sound like an exaggeration, it illustrates the impact of the transplant on their lives. Many seriously question if dialysis is worth the problems, side effects, and complications. Yes, it keeps them alive. But it also shows why patients with organ failure are often willing to take higher risks for a successful transplant. If this is the case, why can't everyone who needs it get an organ transplant? The fact is, we don't have enough acceptable organs. Recent advances have allowed more transplants from incompatible donors by using intricate living donor exchanges, non-directed living kidney donations, and new matching and immunosuppressive therapy. If we can get willing and able living donors, the 100,000 long waiting list for kidney transplants can be virtually eliminated. I know doctors and nurses who have donated kidneys to their patients. Spouses, friends, relatives donate each year to their special recipients. And truly altruistic human beings have donated to strangers waiting on the list. The courage, kindness, and compassion of kidney donors is truly remarkable, and I admire each and every one. HealthTap is excited to introduce Dr. Steinmuller, a nephrology and dialysis specialist, who has been in practice for 40+ years and has taken care of patients with serious medical problems including hypertension, autoimmune disease, organ failure and transplantation, kidney and cardiac disease. He is also available to see patients regarding sexual problems related to medications and medical problems. Learn more about Dr. Steinmuller on HealthTap at